Um, Thanks for everyone being here, and you might have to bear with me a little bit for two reasons. This is my maiden voyage doing this sort of thing, and sometimes our connection here in the foothills of Emmett, Idaho tends to bounce in and out. So if I get cut off, I'll get back as soon as I can. But thank you for being here. And we're going to talk about vaccines and immunology initially for sheep and goat producers. So we're going to start with a discussion about vaccines and what they are and what they're made of. Vaccine makeup. The vaccines are basically made up of chemical components we call antigens that stimulate the body recognizes as not self or foreign, and tries to develop a resistance that we commonly call immunity. And these components can be proteins from the organisms like viruses and bacteria. Can be cellular components, which are common things that will cause autoimmune diseases in people. So sometimes our own systems show up as not self and create problems. For vaccines that we use, most of the source of the components come from viruses or viral products, from bacteria, and from parasitic components. We have for small ruminant, basically for food animals in the U.S., we do not have any parasitic vaccines. We do have a considerable number of viral and bacterial vaccines for food animals, many fewer for small ruminants, and we'll talk about that a little later. Another common component of vaccines are what are called adjuvants. Those are also chemical additives that are put into a vaccine to help stimulate the immune system to respond to that antigen and produce antibody. And since the majority of the vaccines that we use in small ruminants have adjuvants, they're a very key component to the vaccines. The downside to these adjuvants is that they can also cause some adverse reactions, such as potentially soreness, swelling at the site of injection, and even some problem with immune dysfunction. They're also the major component probably that cause people to think about not using vaccines. We've had some products in the past that they thought were causing behavioral problems in children. I'm, tongue in cheek, I'm a little bit in agreement, because most of our veterinary vaccines have adjuvants in them. And if they do cause ADHD, now I understand why my cows are so hard to work with, and possibly sheep too. Let's talk about the types of vaccines. We actually have two types of vaccines. We have live products and inactivated or killed products. The live products are primarily viral. There are some bacterial products, but what they do is they actually, following injection into the animal, they produce a mini infection to grow, to produce enough of that not self antigen for the host to recognize that it needs to put an antibody response. Whereas killed vaccines, that antigenic mass, or the stimulating amount, is injected each time you inject the vaccine. One of the problems with live products, and at this juncture we don't have this problem in small ruminants, is they can cause true disease, and in cattle, certain ones can routinely cause abortion in pregnant animals. The inactivated products, which are called bacterins for bacteria, and generally KV or killed virus products, are routinely made up of pieces and parts of a virus or a bacteria, or the whole virus. The nice thing about killed vaccines is they are safe. They don't cause real infectious problems, although, like I mentioned, the adjuvant may cause some localized swellings. And inactivated products are the primary type we have available for use in sheep and goats. Talk a little bit more about adjuvants. They stimulate the immunity, can increase the inflammatory response, which is important for antigen recognition. They also increase antigen processing. That is, the cells that are responsible for taking that unknown chemical or not self chemical and processing it and stimulating the immune system. And many of them are designed to prolong the release of that antigen so it stimulates the immune system longer. And like I said, they're used primarily with inactivated products. However, on the other food animal side of the program, cattle especially, we have several combination mixed live and killed products which do have adjuvants, generally in their diluent, whereas the modified live vaccines do not have adjuvant in them. The key thing to remember is that freezing of a vaccine with an adjuvant will destroy the structure and function of that adjuvant. So you don't want to leave your refrigerator out in the barn and think, boy, we're lucky we're not having to pay for electricity because everything's freezing in the winter. It's also killing your killed vaccine or inactivating it. There are multiple adjuvants that are used in food animal vaccines. The most common one used in small ruminants are what we call the alums. They're phosphate and sulfate salts that are used to stimulate the immune system. There are some of the older ones that do have the water and oil emulsion in them. Some vaccines, although there are none of them in the small animal side, that the adjuvant is actually a part of a bacteria like the Express that's listed below here. Let's talk a bit now about immunity, and we've alluded to antigen recognition, and antigen recognition requires an antigenic mass, and the antigenic mass is the amount of antigen necessary for the immune system to recognize and to respond to it. And that causes the immune system to respond. It's not self, and it needs to be eliminated. And it stimulates the production of immune cells, an antibody, and hopefully will establish memory so that we're protected on a second exposure quicker and better. As far as the types of immune response, we have what's called natural resistance, and that's just physical structures like intact skin, tear function, which is kind of a functional natural resistance, salivary secretions, gastric fluids, things of that nature are they number one, either won't let the organism attach to a cell, or they will in fact inactivate it. Then we have what we call active immunity, and that's the immune system or the body reacting positively to produce an antibody. In that active immune system, we have two types of immunity. One's called innate, and the other's called acquired. Innate is what we're born with, and it's in many respects, it's something we've only been discussing in the last 10 to 12 years. We have discovered that animals that we initially thought, like when I went through vet school, we were told that calves and sheep didn't have any immune system until they were at least 4 months of age. We now know they're born with a functional immune system. It's different than how we could identify it in those previous days. So we are going to see some changes in vaccination programs, I think, here in the near future because of utilizing the innate immune response. The innate immune response also stimulates or primes the acquired system, which is actually the system that responds to antibody or responds to antigen, recognizes it not self, and then stimulates cells directly to produce antibody for removal of that antigen or not self product. There's another form, and that's and in acquired, we have the cell mediated, which there are certain cells that will take out infected cells. We have the humoral, which is the circulating antibody. That's very important. And then we have what's called local or surface immunity. And currently at this time, we have no licensed products that stimulate, specifically designed to stimulate the local or surface immunity like we do in cattle. And then lastly, we have passive immunity, which is the injection of antibody into an infected animal, and also colostrum, going into babies is a passive immunity. So that antibody comes in passively. It's not produced by the infected host, but it can function within the host. So if we take a look at the innate immunity, the key to it is it's quick, responds in just a matter of hours, and it is broad spectrum. It doesn't necessarily respond to specific proteins or antigens per se. It's an extremely complex system that if you're a molecular biologist, it's an absolute dream. If you're not, it looks like a nightmare. But it will respond to various types of organisms. So like one innate system will respond to organisms that carry DNA, like certain viruses, or RNA, or certain proteins, like the lipopolysaccharides on some of the bacteria that cause problems for us. So it's a broad spectrum response. We don't have, the reason we missed it for so long is we didn't have any way to monitor and show that this system was functioning. Now that through challenge studies, they realize that they've even been able to show that they could vaccinate sheep and calves in utero and then challenge them shortly after birth, and they were protected. And that actually, when they were challenged, they responded like a booster vaccination. So like I say, this is where I think we're going to see some changes in vaccination programs. Okay.
Can we pause for one question?
Yes.
The person labeled owner, I've allowed you to ask your question there.
Oh, okay.
What if we don't have a sheep right now?
I'm sorry, what was the comment?
What if we don't have our sheep right now?
Well, you probably don't have to vaccinate them then.
And what?
Okay, and then the other question that was asked is, can people make a parasitic vaccine for food animals?
There are groups working on vaccines for some of those. One that I know of that they're working with, USDA, some people at USDA have been working with, is trying to develop some vaccines for coccidia. But I don't know where they are with that. They have some parasitic vaccines that are used in other countries, but none that I'm aware of in the US.
Okay, thank you.
Okay, so back to acquired immunity. It's basically to respond to the non-self proteins and then produce antibody or immune cells. The problem with it is it takes time, and that was, we generally do not demonstrate antibodies post first vaccination for about 10 to 12 days that we can demonstrate very high levels of antibody. So it tends to take time. The thing that the primary component of is that it stimulates memory, so that once an animal is fully immunized and everything clears up and goes away, the system remembers that it was immunized to that particular virus or bacteria, and on a second exposure, whereas it might have taken 7 to 10 days the first go around to produce antibody, on a second go around, it generally takes about 48 to 72 hours to identify protective antibody or protective cells. Okay. And that's the main component of what we do with vaccination, is we're stimulating the acquired immune system, planning to develop a memory so that they're protected on subsequent exposures. And this is a diagram of a typical acquired antibody response. Initial exposure, like primary vaccination, get a short spike in antibody production. It tails off fairly fast. We booster it or get a second exposure. The peak that climbs up is quicker and higher and tends to tail off longer. So we are shooting to try to get that rapid secondary immune response. There are multiple factors that do affect the immune system or vaccination. First of all, we talk about animal factors. Nutrition is the key component basically to all health. I always say as a veterinarian, there's not much I can do unless the animal is properly fed and taken care of. So they have to be in good nutritional state, appropriate microelements, minerals, protein status, energy levels, so they can respond to an exposure and their immune system can function and produce antibodies. The other thing that common we talk about is stressors, environmental stressors such as cold and wet, certainly affect the immune response. Age of animals, we know young animals are, at least sheep and cattle and goats, they're born without antibodies. And like I said, until a few years ago, we didn't think they were able to respond until they were 3 or 4 months of age, which was one of the major arguments for making sure they got their colostrum. Colostrum is still very, very significant in young animals to protect them from their initial exposure. Before that innate immune system may even be able to pick it up and recognize it. Some of the other things that affect vaccination is pre-existing antibodies or diseases. We do know that colostral antibody will interfere with vaccination using modified live vaccines, because that antibody can neutralize the antigen that we inject, and there's not enough antigenic mass to stimulate the immune system. And then there's another one we just call unresponsiveness. We know that depending on the situation, somewhere between 5 and 30% of vaccinees just simply fail to respond to a vaccination. We generally equate that to stress. If you're looking at your routine group of sheep that you deal with every day and you vaccinate them, you're probably looking at 5% less non-responders. They've been loaded up on a truck and hauled to a feedlot and going to be vaccinated there. Their stress level's higher. You might have 25, 30% of them that won't respond. Then there are management factors too, and stressors are being the major one related to animal handling. We're really working for easy animal handling and easy animal processing. Then the other management factor is how you handle your vaccine. Make sure it's diluted right, it's stored right, that your timing for administering it to the animals is appropriate, and also route of administration, as per the label, is important. A couple of things about vaccination. In the past, there have been some people that have taken their modified or their vaccines and diluted them and used half a dose with the idea, especially in young animals, thinking, well, they don't need that much. What you're doing is just reducing the effectiveness of that vaccine. More commonly, for those of us out in the world, you stick the needle in and you squirt it through on the ground, or your needle pops off and it blows it all back in your face. With a modified live product, it's probably not so important to worry about redosing them if you think you got part of it in, but it's fine to go ahead and redose, because these vaccines are all tested for safety at 5 to 10 times the immunizing dose. With killed products, if you miss, it is really important to redose, because they really need that full dose to get that antigenic mass. So in summary, if you miss with a killed product, redose. If you have a modified live product, you can redose without worrying about really causing a problem, because they've been tested for safety at higher doses. Remember that vaccination doesn't mean immunization. It's simply just giving them the antigen and hoping the system will respond and immunize. There's several reasons that we know can cause vaccination failure. And a lot of people have equated vaccination failure to the vaccine causing the disease. Very rarely has that happened with our commercial vaccines. They're very heavily quality controlled. There have been a few instances in the years past that they were contaminated with another virus or something. But generally, when we get disease following vaccination, it's really most commonly due to the animal incubating the disease when we gave them the vaccine and then they broke. Another reason the vaccination didn't work is we didn't administer it correctly. We squirted it through the skin and on the ground. Our vaccine was inactivated because we left it sitting on the fence post at the chute for too long. We have had the occasional contaminated vaccine, although the biggest problem for contamination for those of us down in the field and owners is contaminating the animal at the site with a dirty needle. And that really hasn't resulted in vaccine problems, but it can result in abscesses and stuff on the animal. And then the other key one, really the most common one when we're processing them outside of the non-responder is they were missed as they came down the alley. Vaccination break is the true definition of where the vaccine causes disease, and it's generally, pardon me, due to contamination. We do know that with some of the modified lives in cattle, if you vaccinate a pregnant cow with a certain vaccine, you can definitely cause abortion. So that would be a vaccination break. The vaccines come with label claims of what they will do. On the right-hand side, there's a thing called multi-tier labeling. That is no longer used on the vaccines. It was considered way too confusing and didn't really cover the parameters. The label now says on the vaccines, and some of the companies are still in the process of changing their label, that says this product has been shown to be effective for the vaccination of healthy animals X weeks of age or older against a given antigen. And beware that effective for vaccination does not, this day and age, necessarily mean it protects against disease, because a lot of our vaccines, newer ones, because of animal welfare, animal use problems, are not they may not even do real challenge studies with them to get a vaccine license. They'll use laboratory methods to demonstrate the production of antibody, et cetera. One of the things that we're seeing more and more common on vaccines is called duration of immunity. And in those cases, the companies have done challenge studies to find out how long after vaccination the animal should be protected against the disease. Okay. This is, and there's a handout to accompany this too, recommended sheep and goat vaccines for a yearly basis. For me, the core vaccination, what every animal should get every year, are the clostridial diseases, Perfringens C and D, and Clostridium or tetanus vaccine. The other vaccines such as Vibrio, caseous lymphadenitis, blue tongue, etc., those should be applied based on disease problems, environmental or special requirements for those diseases. So, work with your veterinarian on applying these other vaccines. At this juncture, all the approved vaccines that we have for sheep and goats require two doses for primary immunization, 2 to 4 weeks apart, and in yearly boosters. My recommendation is that any purchase you make or new introductions, isolate these animals for a minimum of 2 weeks and revaccinate according to your protocol. And then consult with your veterinarian for protocol changes and programs. The one thing I would like to mention is that I do know that there are some people that have used non-sheep vaccines in their sheep. Vaccines as opposed to antibiotics, there really isn't an extra label situation. You could, in essence, you could use them on anything you want. It's strictly at your own risk. You basically have no recourse if something goes haywire because they have not been tested or approved for use in those species. But I do know there are quite a few vaccines of non-sheep type that have been applied in sheep problem, in certain sheep situations, sheep and goat situations. Any questions? More questions?
We had a question about what is vibriosis?
Vibriosis is a Campylobacter organism that causes abortion in sheep. Pretty common in large commercial flocks. I haven't dealt with it a lot in small flocks. Chlamydia tends to be more common abortifacient, certainly in goats, and a little larger extent than vibriosis in small backyard flocks of sheep.
Okay. The next question is, can we go from a basic perfringen vaccine, such as Tasvax or Covaxin, to a combination one that includes caseus, such as Glandvac?
They're the ones that are on the sheep side. The vaccine that's out there is for the Clostridiums and the para-TB or the caseus lymphadenitis. I don't believe there's a combination for goats yet, and we've only had a case back for goats fairly recently. But you can, if they're labeled together, you can go back and forth without much concern.
Okay. When you said through the skin onto the ground, do you mean the literal ground?
Well, hopefully it's that and not into your finger. That's normally what you see is somebody pokes it in as an angle and it goes all the way through 2 folds of skin and it squirts down the side of the animal, or it doesn't even go into the animal. That's one of the reasons why I do not do tenting techniques where I pick up and insert the needle, especially in an alleyway or something, because it's surely a good way to inject yourself.
Okay. There was also a question about, are there any breeds that are more vaccine resistant than others?
I'm not sure what they mean by vaccine resistance. I mean, there are some disease variations in species. I couldn't necessarily say that would be the case with various breeds in sheep. I'm not aware of any discussion along that line in terms of breed variation of disease.
Okay. What is chlamydia?
Chlamydia is a small intracellular bacterium that causes abortion. It can also infect people, so it is a zoonotic. In goats, for me, it's basically the primary cause of abortion in goats. It can cause abortion storms in sheep, although in the commercial flocks, like I said, vibriosis is more common abortifacient in the larger sheep flocks than in the small flocks. There is a vaccine for it. It tends to be a very controversial vaccine as to how well it works, because like I said, the virus or the organism, which is actually a bacteria, is intracellular. And so in one respect, it's sort of like a virus, and then it can come out and live outside a lot longer than a virus. But and it's also very difficult to select and produce a good vaccine to what portion of it we may need to produce antibodies against to protect. Fortunately, chlamydial abortion responds pretty well to antibiotic therapy.
Okay, great. So you had a list of optional vaccines. Is there a way to test for those diseases and know whether or not they should be administered?
It's a good question. And in the main, we don't have good pre-diagnostic protocols, go in and screen a herd and see if it's there. Most of those diseases that we talk about that are listed in that optional vaccine, those diseases are around. Some cases, areas they may be very common. Other areas, counties, states, whatever, and even premises may or may not be more prominent. So generally, we make a determination on what we should be using by doing the diagnostic workup on the disease problem. Or if you know the history that's been going on in the flock or the area, then if a lot of your neighbors have been having a problem with caseous lymphadenitis or whatever, then many people will say, well, I'm going to apply it to my flock, which is reasonable.
Okay. How effective is sore mouth vaccine?
Sore mouth is a good vaccine. It works well. The dilemma is that if you don't have sore mouth in your flock, you can vaccinate with it and end up with it there because it's basically a live unattenuated vaccine. So you can actually introduce the problem into your flock if it's a clean flock.
Okay, so along those same lines, if you're vaccinating for caseous, are there any concerns using it on sheep that are already showing lesions or bumps?
There aren't any concerns, and considerable discussion among veterinarians and owners that it may, on top, if you've already got the problem in there, that it may in fact help reduce your problem. It's probably key to apply it to your new lambs or kids when they're born to help give them an immunity. The problem with it is that once you give them the vaccine, I know there are people in the past, if they buy an animal, they want it tested for caseous lymphadenitis, and if they've been vaccinated, they will come up as a positive, and then somebody may not want to purchase them. So you have to look at that side of it. Can give you at least in that respect a false positive that you got an animal with antibody, but probably and hopefully no disease because they've been vaccinated.
Okay. This question wants to know if vibriosis is just found in sheep or is it also a goat disease?
I have seen discussions on vibriosis in goats. I have not seen it per se in goats. Sheep way more commonly, at least in my experience.
Okay. The next question is asking what age you can begin vaccinating.
Well, that's a very good question, and that's one of the things that I think we're going to see change because of what we're learning about the innate immune system. Various, you'll see all kinds of protocols. We do not, like I said, we do not have any vaccines that are identified for oral or intranasal immunization in sheep and goats, although we do have some in cattle. And so some of those are being applied essentially at birth. We have no vaccines that are licensed for that at this juncture. A lot of veterinarians, a lot of producers, certainly on the cattle side, are vaccinating, within the first 2 or 3 days, commonly for Clostridia, and then maybe 2 or 3 weeks out for some of the respiratory type diseases. So there's a lot of variation, and there's in many respects, a lot of unknown with that. If you're going to, the nice thing in one respect on the small ruminant side is our vaccines are essentially all killed products. There's a couple of live ones, the contagious ecthyma, and there's a blue tongue one. Most of them are killed, so we're not going to be causing disease problems in the animals with the vaccine. And we may afford some protection by immunizing them earlier. We do know that giving a vaccine to a newborn, a killed vaccine to a newborn, that they can respond at certain periods, at least they've been done, and they're generally older animals, that they will produce antibody in the face of colostral antibody, whereas they would not do that if they were given a modified live, because that colostral antibody that's in the blood would inactivate the modified live vaccine and they wouldn't be immunized.
Okay. The next question is, do you recommend core vaccinations in a closed herd, such as a group of 10 or less goats?
For the clostridials, I do, because those organisms are common soil organisms and they're everywhere. I would, every animal needs it.
Okay. This question is regarding blue tongue disease. It's found in their local deer population. Is this easily transmitted to sheep and goats?
It potentially could be because of the organism that transmits it. I can only recall one presentation discussion at a meeting in the last few years where it was felt that blue tongue had come from some deer into a small sheep flock. As I recall, in that particular one, it turned out it probably didn't, because the strains of blue tongue were different between the deer and the sheep. But potentially it could.
Okay, there's a follow-up question on that. How severe is blue tongue disease and how do sheep get it?
Okay, sheep get it by biting midges. They're called culicoides. It tends to be a seasonal thing in the fall. The main thing it causes is, from what I see, is sterility in the rams, because they get an infection, a very high fever, and then they're sterile for 4 to 6 weeks. That's the most common thing I see. You will see when they get it, they will get to be very stiff. I've never seen the blue tongue, no matter what anybody says, but they do get swollen ears. They can get a swollen face from it. If it's bad, they may quit eating, especially if lambs get it. It can be very destructive in lamb populations. But the most common place I see it's in rams, and unfortunately around here it occurs just about the beginning of breeding season. And so they're sterilized for 4 to 6 weeks, and you might end up with a ram you thought was working, or a billy, because I have seen some positive billies, nowhere nearly as many as in sheep. But you put a ram in and not get any offspring because he's sterilized for a while, or they're very late kidding lambing.
Can goats also get blue tongue?
Yes, but I have not seen it to the extent that we see it in sheep. And it might be better fly control, pest control amongst the goat situation than we see. And most of what I see tend to be in larger sheep flocks too.
Okay. One more written question here. Are there any vaccines for scrapie or mastitis?
There are no scrapie vaccines, and there are no mastitis vaccines available for sheep. That's one of those where I have heard some people have tried to use JVac or something like that, E. coli vac from cattle, but I have not heard the outcome.
Okay. One verbal question from Danielle Wistison. Go ahead. Maybe.
Does blue tongue affect rams?
Affect lambs?
Rams.
Oh yeah, that's where I see the major effect, because they get infected, they get a very high fever, and it temporarily sterilizes them. It kills the sperm because of the temperature. And they might be a little bit lame sometimes, but generally we find them as sterile rams. Then somebody says, "Oh, remember we had a serious outbreak of lameness and high temperatures and stuff a while back."
Okay. Can you discuss briefly about keeping different breeds of or different types of livestock together and how disease transmission looks?
The common farmstead is a lot of species together. We're fortunate in many respects that there's not a lot of disease jumping back and forth. Most of the things that we see tend to be pretty species specific. Contagious eczema is one that can go between cattle and sheep and people fairly readily. Coccidiosis is one that I hear about all the time, and it is very species specific. It doesn't come from your chickens, and it doesn't come from the sparrows. It comes from the same species. Most of the viral infections do not seem to, at this juncture, seem to jump from cattle to sheep and what have you. The only thing that they can run together, at least that we're concerned about for all species, would be something like rabies. Fortunately, in Idaho, we have very little rabies. We can vaccinate for it, but our rabies is bat origin. And trying to think what else might be. For the most part, there's little to no cross-species jumping with things. The basic problem with parasites and wormers is my voice coming through?
Sorry, yes, it is.
Okay. The biggest problem we have with wormers is we are seeing increased resistance. That is, the wormer will not work against the parasite that's giving us trouble. We have a limited number of drugs that we can use, and we are seeing resistance to all of them. We have, and we've overused or misused what we do have, and the real dilemma is there really aren't any new ones on the horizon at this juncture. What I normally see is there are two scenarios out there with parasites and small ruminants. I'll get a call and say, I've got worms, what can I give it? And the other one is I always like this statement: if you have sheep or goats, you have parasites. So what we need to do initially is we need to confirm that that's the problem based on what you see and what you have. And if you look at, first of all, let's look at the host. What are we seeing with the host? Anemia. If you look at the eye here, it's very, very pale. If you look at the gums may be white. If they're terribly anemic, you may have what's called bottle jaw, like the picture of the goat that's got fluid underneath the chin. You may just have poor production. They're not growing well. They're not producing wool well, what have you. Poor body condition. They're not putting on weight like you'd see. Certain parasites can actually lead to weakness, which generally is related to anemia. And that anemia also to debilitation, which is poor condition and weakness kind of put together. I get a lot of comments about diarrhea, with the exception of coccidia. I don't see very little of diarrhea that I would attribute directly to our intestinal worms. We can get death from the anemia from parasites. Generally, it has to do with what I call ADRs. They ain't doing right, so our parasites the problem. So the culprits, the culprits are various parasites, and how do we confirm them? The best way to confirm is to take a fecal sample from your suspect animals, send it to your veterinarian, and have them screen it for parasite eggs, so you know exactly what you have in there. Another way of doing it, and we're not going to address that to a big extent in this one, is what they call Fomantia. It's a mechanism for looking at the eye for the level of anemia and help you determine if you need to treat for a specific parasite, Haemonchus, which tends to be the most common problem in small ruminants by and far. So we want to confirm that we actually have a problem going on, and not just throw a parasiticide after them because we think there's something going on. The reason being we want to get away from doing that is so we're not further producing more resistance, and we're actually trying to control something. Fomantia, like I said, is for helping determine the severity of Haemonchus contortus, which causes anemia in sheep and goats. It was initially utilized for use in sheep and goats. The major thing with this is that there are Fomantia guides. You have to go through a training session to be able to acquire that anemia guide. My recommendation is, and I utilize the system a lot on my own without the guide, because you can determine pretty readily in a group of sheep or goats that you got some that have nice pink conjunctiva, like the top one up here, versus those down on the bottom that are real pale. And it can give you right there a pretty good idea that something is really going on. Um, so what can we use and how do we use them? Like I said, we have three classes of dewormers. We've got the benzimidazole groups, valvazine, safeguard, panicure, the avamectins, ivermectin, moxidectin, and then we have those in the levamisole group, prohibit, etc. The problem is that we have resistance to all three classes, and if you have a resistance in one of them in that class, you're going to have varying resistance to all of them in that same class of wormers. And common deworming practices that have brought this about is we've rotated dewormers one at a time too close together. We treat the animals and immediately move them to a clean pasture, so we're reseeding the new pasture with the resistant organisms that it didn't kill. Same sort of thing as treating kidding before you put them in a pasture. You treat them, move them to a new pasture, and you're dumping out the resistant worms that the kids are going to pick up. One of the common things that I see, and many producers and veterinarians are at a disadvantage for this, is we underdose. We don't have the weight. We're going to guess it, and we tend to underdose, and which underdosing really fosters the process of producing resistance. And the other thing is treating too often, which is, we're treating, we've moved everything out except the resistant organisms, and we just keep them exposed to it and they become more and more resistant. So like I said, we go back to the problem of resistance, and these are important factors to remember. We have what's called side resistance. If there's one in a group that's resistant to the one we're using, then it's very likely going to be resistant to all the drugs that are in that same group. We are seeing some multi-drug resistance, and that has to do with monthly rotation of vaccine. I've dealt with some flocks where people have been using a different vaccine every month, whether they need it or not, as it were. Consequently, we have developed some super resistant worms in various areas. The Southeast is having, in certain areas, they really can't find anything that works for them because they've got lots of parasites. They've used them a lot and they have nothing to work with. So the contributing deworming practices, if you treat them and move them, you're spreading only the resistant worms to the new pasture. If you're doing spring kidding and stuff and lambing, many of these parasites, especially homunculus, become static over winter. They overwinter in what's called a hypobiotic state. And so we treat them, put them out, but the worm wasn't active, so we didn't get it treated, and then we're dumping them out in pasture. And then over treating them, we're giving it too often. We're not weighing the animals, so they're not getting the right dose. And although most people are now that have goats have realized that our treatment regime for goats has to be higher than sheep. Their metabolism is different. So normally we dose them at 2x a sheep or cattle goat. So when some better practices to use, I think, in terms of parasite control, if you're going to treat and you're trying to do your guessing, the best bet is to have a scale, but treat for the heaviest animal in the class, not the average. You're better off to overdose them a bit than to underdose them. Goats, again, heaviest class, 2x the sheep dose. Make sure you have the right equipment for dosing it. If you're doing oral, you want to make sure you get it well behind the tongue so you get it into that esophageal groove, and that your dosing syringe is calibrated and will give the right amount. One thing that has been reported, that most of us that do dosing, there's a certain amount of it that's spit back. Sometimes it looks like it all comes back. The companies, I have been told, they have taken into account how much the average animal is going to regurgitate and then swallow at a later time in terms of determining their treatment level. So we know they're going to spit some back, but they should still be, if we get it all the way over the bulb of the tongue and back close to the esophageal groove, they should get what they need. Another thing that's important to do is once you, for treating the animals, if you restrict their feed for probably 8 hours before you worm them, and then restrict them for another 24 hours. That increases the contact time of the wormer with the worms and the eggs. You don't want to go much with young lambs. You're doing that, and we're not doing a lot of baby young lambs. You want to be careful about how long you hold them off feed. Selective deworming is becoming the major mechanism of deworming at this approach. Some of the people that are doing routine semi-annual wormings, they will routinely worm only 75% of the animals. A lot of them are using the FAMACHA type approach on those animals and pick those that, you know, make sure they treat those that look like they're anemic. And then after you worm them, leave them on that contaminated pasture for 3 to 5 days before you move them to a new clean pasture, so you're not contaminating, pardon me, the new pasture with resistant worms. When you're buying animals, don't buy resistance. You know, get a good idea of what they're doing for treatment process. If you buy those animals, go back to the quarantine program for a couple of weeks, take fecal samples and see what they're shedding and how much. So quarantine and test the fecals. My recommendation is anytime you're having problems and you think you need to worm, run fecal samples in and determine exactly what's going on, how heavily your infectious rate is. Work closely with your veterinarian on that. One of the newer approaches is, when you are worming, is to use a combination of 2 at the same time, an oral and an injectable simultaneously, or an oral or a pour-on, knowing full well that pour-ons in sheep routinely don't work well at all, except right at shearing or right after being shorn. If you got contaminated pastures, as you rotate, try to rotate the pastures, try to rest the pastures. The biggest problem I deal with in terms of the backyard small farm situation is, from my perspective, most of the situations are way overstocked and they don't have the opportunity to rotate pastures very readily. So once the problem gets started, it's a constant battle. There is a technique, and if you go, unfortunately I wasn't able to find the website, but if you go to FDA parasite resistance, they have a wonderful presentation on refugia. And basically that's how we worm to make sure we're keeping susceptible worms in the population without creating more resistant worms. And that goes back to test before you treat. Don't treat everything on a daily basis, as it were. Try to keep those resistance genes diluted. I said the biggest disease problem I see with parasites really is anemia due to homunculus, and I see that more commonly in goats, and coccidia in lambs and kids can cause a real problem. The wormers we're talking about here do not touch coccidia. You have to go to some other parasiticides such as chlorsulon or decox, or even sulfas to treat or control. So, like I said, the major disease problem I see associated with actual clinical disease is anemia. Owners, they see, because watching their animals, that they may not be performing right, and low levels of parasites, and some very high levels of parasites without clinical disease, can certainly affect your production, growth, etc. in your flocks. Questions?
We do have a few. The first one is, what type of worms do sheep normally get, which you may have touched on earlier?
Well, there's the most common one, the most common problem child is Homunculus contortus. There are things called, which that one's called the brown, the barber pole worm. There's some stomach worms. We have some roundworms, strongyloides type organisms that are in the small intestine stuff that generally don't cause much problem. One of the things that didn't address that should is that sheep and cattle, at least on the adult side, tend to develop some moderate, some of them fairly good immunity to parasites. Goats apparently miss that, do not develop very good immunity. And one of the discussions I've heard about it is that we've changed the lifestyle of goats from browsers, where they weren't eating on the ground picking up worms, and made them grazers. And so we've really, from my way of thinking too, we've really fostered the problem by letting goats and forcing goats to eat pasture grass instead of bushes. I know when I had a goat, eating the bushes always resulted in them wiping out my wife's favorite trees or plants. So, but there is the immunity situation that, as a rule, certainly with sheep, adult sheep have much less problem than young sheep. Although you can get some older sheep that might, with a severe homuncus, maybe once every couple of years, I'll run into an adult sheep that probably, well, for whatever reason, was never treated, and the homuncus finally got the best of it and ended up with bottle jaw or what have you. Bottle jaw, and then, like I said, the anemias are way more common, more commonly seen by me in goats.
Okay. Is there any concern with overdosing dewormers?
Well, there's always a concern in way overdosing, because they tend to interfere with chemical function. That's how they work with the parasite. They interfere with certain chemical actions in the parasite, and some of those can spill over and affect functions within the animal. Most of the ones we have out there tend to be very safe, take very high doses to actually cause problems in the host with the compound that we're treating with. Chlorsulon or Corid on the coccidia side, that's one that you can way more commonly cause a problem by overdosing it than you can with the ivermectins or the safeguards, things of that nature.
Okay. So you mentioned earlier one of the strategies is to deworm 75%. Can you go into why that's effective compared to doing all of the animals?
Well, what we're doing is we're making sure we're not wiping out everything that's susceptible, and hopefully if there are susceptible organisms left in a few of those, you know, they will be shed in the pasture, they'll be picked up by animals. In the sheep, we think it might help develop an immunity because there's not enough to cause disease. But by treating all the animals, we know all we're doing, you know, is we're dumping out everything that's not treated by the compound that we give them. And if we keep, you know, we treat them, bring them back in next year and treat all of them again, and nothing has changed, we're not going to have any effect on the population at all. So if you treat a portion of them, you're leaving some susceptible animals in there. You're not overloading the pasture situation with resistant organisms also.
Okay. There's a couple of questions regarding if there's any way to remove parasites from the pasture besides just rotating through, or maybe discuss further what that rotation might look like.
The major thing for parasite control really is sunshine and frost. And rest. A couple of things. We know many of these parasites, the eggs are shed on the ground, the worms hatch, come out as what's called microfilaria, and they migrate up the grass in the dew droplets and things, but they don't migrate very high. So if you graze your pasture down and leave, you know, a minimum of 4 to 6 inches of stubble, they're not eating down into the bare dirt and picking up the eggs and everything that's on the grass. So leaving a good cover on your pasture is important. Again, this goes back to the problem where most people, from my perspective, again, many people are overstocked and don't have enough pasture that they can rotate, let the grass regrow, let it, you know, sun dry it out. Plowing and harrowing and stuff, certainly fall or whatever, would help expose them to frost. That's part of the problem that the Southeasters have, is they don't have any frost and they have consistent moisture. So that really puts them at a disadvantage, whereas we tend to have, excuse me, dry climes, cold in the winter that, you know, hopefully will kill a bunch of those eggs and things. And then if we go to good pasture management, don't let them eat it into the ground, rotate them often to new pastures, that you can reduce your worm load quite significantly through that.
Okay. So you recommended injectable and oral. Was that either or were you recommending that you do both at the same
The
time?
recommendation is now, and I've only been applying it about a year, is to give them at the same time. So you're doubling up to get everything again, but making sure you're doing only about 75% of your flock, and generally not just applying it on a blind basis. Check, make sure you got problems going on in there. My small flock clients, I recommend that they do a FAMACHA type exam at least on a monthly basis. And if they've got something that's terribly anemic, like I said, homunculus is going to be our biggest problem outside of coccidia and baby lambs. That if they treat those individuals that are anemic and do the double treatment regime, that seems to help quite a bit.
Okay. So there are a few questions about having sheep or goats with other species like horses or llamas. What's your recommendation on deworming protocols in different species living together?
Well, again, like I said, that there's very little sharing of parasites, especially between species. So you really need to develop a parasite program for each of your species. Again, make sure you know what the problem is. Treat for the species, for the worms that are the problem with them. Horses, we're way more concerned about strongyles and things of that nature. Cattle, we're worried more about the internal parasites, and we're starting to see considerable resistance in cattle parasites too. So we're addressing the same sort of problem in the cattle side that we talked about here with the sheep and goat side. Don't treat everything every year, and be sure you're treating for something that needs to be treated. The downside is years back that there was considerable data put together that showed worming helped production, especially in cattle. A lot of that was done in the southeast and the southwest, Midwest sort of thing, where there were higher parasite loads, and those animals, a lot of them were ones that went into the feedlot, and they did produce better if they had been dewormed before they went in. And I think that's kind of what drove a lot of it, that we're going to, especially on the cattle side, that we want to worm every year because it's going to improve production. And it's, the data is not recent on that, to my way of thinking.
Okay. Is there any considerations with deworming, whether the animals are gestating or not?
The only one that that I'm aware of that can potentially cause some problem, and you shouldn't do within about a month of breeding and about 30 days after breeding, is valbazin can interfere with conception and or potentially cause fetal anomalies. I honestly have not seen that reported in sheep. That data was put together on some studies in cattle years ago. But it is you will see it on the label.
Okay. One of the questions is using horse dewormer on sheep and goats, but I presume you want to use whatever is labeled for sheep and goats.
Well, there are, yeah, and we tend to have the same wormers that are labeled for sheep and goats, the ivermectins, valbazin, we don't use so much in horses, Panacure, those sorts of things, that there are products that are labeled for sheep. Sheep anyway, goats tend to fall off the map for all of that stuff. We routinely just apply double the sheep dose, as it were. There aren't a lot of them out there that actually have a sheep and goat label on them, but bulk of them have sheep labels.
Okay. Are you aware of any parasites that can cause goats to lose hair around their eyes?
Probably Demodex mite that has been reported in goats. Not that I've seen it reported with hair loss. The most common thing I've seen heard associated with hair loss in goats is either mange or ringworm. when you get something lost around the eyes. Having said that, I have not dealt with but one or two cases like that in recent history. And
Okay.
one of them I know did turn out to be a ringworm.
Yeah. Sounds like maybe they should have somebody come take a look at them.
Yeah.
How often do you recommend changing dewormers? Rotating.
Generally, with this double dosing, when you go to the second go round, change one of the two you're using. Again, said, especially with the small flocks where they're doing, they're treating only the ones that have anemia looking eyes, as it were, and they may be treating only one or two. In that situation, we'll probably run that combination because you shouldn't be redoing the same animal each time. Would probably use it for enough to treat half of the same flock over the period of time which you're doing this, but not reutilize that combination on an animal if it comes back anemic again. The other suggestion is too, with that, is if you've got an animal that routinely comes back anemic, or your wormer doesn't work, that you should seriously consider removing that animal from your flock. And there are some, I have been aware of a couple of situations where people have had an animal that they finally decided was just so resistant they couldn't clear it up, and they wanted to get it out of the flock.
Okay. Do you have any recommendations for treating mites and lice?
Mites and lice.
Yep.
Most of the pyrethroid porons and things certainly will work pretty well in goats. For sheep, mites and lice, the ivermectins, what we call the insecticides, where you can give it orally. They treat both the inside and the outside. It's just they're nowhere nearly as effective on the outside as they are on the inside if it's a drench, okay, or an injection. The best thing is use a pour-on with your sheep, like a permethrin or a pyrethroid or something for lice and mites at shearing, where it can come in contact with the skin and not be interfered with by the lanolin, etc.
Okay. Right now I have one more question. Going back to pasture rotation, can you remind us how long between rotations protect from reinfection?
The recommendation is, it's certainly summertime. The recommendation is 6 weeks. Give it time to grow, to dry out, for the sun and the weather to help you, inactivate some of them. But the general recommendation is 6-week rotation. In some situations, it depends on how rapidly your grass is growing back. If your grass grows back fast and you can put them in there and they can graze it down in 3 or 4 or 5 days without going clear down to dirt, you could probably get by with 30 to 40-day rotation or so.
Okay.
A lot of it has to do with grass length, especially where we're looking at worms that migrate and get into the grass and come up on the side of it and such.
So with that, it looks like hopefully we've answered everybody's questions. Thank you so much for joining us, Dr. England, and sharing with us about vaccines and dewormers. This was really informative. I hope everybody watching also picked up a lot of information. I'm going to pull up this slide quickly. And so coming up next week, we're going to discuss nutrition in sheep and goats with myself. So please join us for that. And again, follow us on Facebook, YouTube, and our webpage for more information. Follow up with any of the three of us, our two hosts, or Dr. England, about other questions that you might have.